NYDIS's webinar in partnership with the Health Department and the New York City Fund for Public Health on the current reopening guidelines and also local restrictions that are in place here in New York City. Helena Duran, my colleague who manages our faith sector community preparedness program, and Alana Tornello from the health department are going to take us through the content for the day. And I hope this is a resource that is helpful. I just want to remind everybody that the pandemic is ever evolving, and the city and the state change restrictions in neighborhoods based on current infection rates, and it's something that does have to be monitored. So what's available today may be different a week from now. So we just want to remind you that there does have to be some intentionality in monitoring the information of where hotspots flare up. We also want to remind you that we are sharing the governor's executive order restrictions. I know there are some debates about what is or is not legal, or what are or are not the rights of congregations to meet. We are not going to be debating those today. We're simply sharing the restrictions as they exist, and we want to emphasize the importance of religious leaders and faith communities educating and updating their congregations, particularly those that speak languages other than English, so that they are getting reliable information, accurate information from people that they trust. Our interest is in preserving human life, and also recognizing that COVID-19 is not just killing a small number of the people that are infected, but it does also sometimes have long-term health impacts on people who are infected, even if they survive, which is obviously most likely what happens. We want to kind of make sure that any questions you have about health-related or medical issues or something you ask to our health department partners who are on the line. And then Helena is really the person to best answer questions about the governor's restrictions and how NYDIS is working with houses of worship. I also would like to give a brief promotional ad, which is NYDIS does stockpile face masks and hand sanitizer. If any of your congregations are not able to afford those things, you can reach out to Helena after the webinar, and she will send you the link for where you can submit a request for face masks or hand sanitizers. Hand sanitizer. It comes in gallon jugs with a pump top on them. So this is something more for soup kitchens and food pantries or people entering worship space, but this isn't sort of personal size hand sanitizer dispensers. And the face masks are federal government issued face masks for those that are not working in clinical settings. So these face masks would not be safe for someone who's working in a clinical environment. These are for soup kitchens and food pantries, worship, school use, office use, and that sort of thing. So welcome again, and I'll hand it over to Helena. Thanks for joining us today.
Great, thank you so much, Peter. All right, so the overview for our presentation today is listed here. We'll have the health department present on the core 4 information and testing resources. And then I will help present on the new capacity restrictions that were put in place a few weeks ago, and show you how to use the tools to know what zone you're in and what the restrictions are for each zone. We'll talk through the guidelines and additional recommendations by NYDIS per category listed below, and make sure that we're covering all of our bases when you are making your plans to possibly reopen for in-person worship. And at the end, we'll have ample time for Q&A. We did have some questions submitted during registration that we will answer, as well as some commonly asked questions, but we do want to hear from you all what your questions are today. All right. So I'll hand it over to my colleague Alana and a few of her colleagues from the health department to present on the core 4 actions.
Thank you. Good morning, everyone. I'm very grateful to be here with all of you as we come together in spaces like this to form one community of people dedicated to serving New Yorkers every day, and especially over the last few months through the unimaginable. I'm joined by a colleague, Jenny, who will be taking the second half of the points I'll be covering. I'm going to go through some, before the main presentation, some things hopefully you've heard before, but we'll be framing reminders for today's topics, specifically around what we call the core 4 messages and testing in New York City. But I did want to say that I'm very grateful to NYDIS in particular for creating spaces like this to tailor resources to trusted messengers like you, who I know will multiply and carry this information to those who need to hear it, to those who you serve in New York City. It's their mind, body, and soul with much sacrifice, innovation, and compassion. Thank you to all of you who have been working for months to keep the numbers down and support reopening. A little bit about where we are. We as a city have seen much progress in reopening, but we know COVID-19 continues to spread in New York City, and there are concerning increases in community transmission in certain neighborhoods. I know that you've seen some of the action taken over the last few weeks in zones that our colleagues at NYDIS will go into a little bit more detail. My colleague Jenny will provide some of a framing for. I just wanted to acknowledge that seeing that info can be re-traumatizing and uncertain. I know that moment that we're in, for those who've experienced much loss in our communities, congregations, families, and more, is a difficult one. So as a reminder, NYDIS and us, we're all here continuing to share the information that we have, but as Peter noted, that information is very important to keep track of our website and stay in touch with all of us as we continue to get updates. So all across the city, core 4 message remains extremely important. I've heard some people compare this to the Victory Garden version for our crisis now, this thing that all of our citizens and community leaders and folks that we work very closely with are trying to do collectively to protect our city. And right now, even though you've heard it many times, I want to reiterate it because it's important to be continuing to share this message with the community members you serve. And the 4 main messages are stay home if sick, only leaving for COVID-19 testing and other essential medical care or other essential errands such as groceries. When we say, what a lot of people have asked me when I've said that, like what we mean by sick, there's symptoms listed on the Department of Health website, but they do include things like fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscular body aches, headaches, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. I know that that's quite a list, but wanted to just note that those are some of the ones that are currently listed, since that's a common question that I get. The second is keep physical distance, staying at least 6 feet away from other people when outside your home. I know you know this one, but it's one that I know as I walk around in my communities, it becomes, especially for us social creatures of humans, a very difficult one. So one to continue to share with your communities. 3, wash your hands with soap and water, using hand sanitizer if soap and water is not available. Last time we had one of these sessions, I had some great suggestions on how people try to wash for 20 seconds, the types of songs or maybe things that you share in your congregational settings to music help count that 20 seconds that you want to wash your hands. So that was a great suggestion. And the 4th is wearing a face covering. That's a reminder that you can be contagious without symptoms. It's important to protect those around you by wearing that face covering. And I do want to expand on this one for a second to say that all New Yorkers must wear a face covering when they need to be outside their home and may not be able to maintain at least 6 feet of distance between themselves and others. There was an executive order around that. And New Yorkers should wear a face covering as much as possible when around other people in an indoor setting, especially that is not their home. So if you could move to the next slide on testing. So testing resources, I'm not going to go into too much detail about these today, so I give time for my colleague, but the main messages are here that all New Yorkers should get tested regardless of symptoms or increased risk. They don't ask about immigration status. Repeat testing should be considered if you have symptoms of COVID-19, you or your provider is concerned about a possible exposure. Actually, if you can go, it might be the next slide that this one is on. Thank you. Has potential exposure, but that could be spending time in large crowds or with someone with confirmed or possible COVID. If you're planning to visit someone at highest risk, this slide I appreciate also has in it, if you work outside the home or if you work or live in a congregate setting, getting tested periodically more often. And before you go, and there's also some information listed in here that I think is helpful to go through under the testing recommendations for test and trace, which has the full list. I know we get a lot of questions about like very specific scenarios, and so please feel free. I'm going to put some links in the chat right after this for people to see where testing sites are. There's 2 links you can go to look for testing sites. That one that shows it by map, the other that lists it by borough and also shows it by where mobile temporary testing vans might be set up, where there's rapid testing. And I'm going to put those both in the chat for people, and we'll share with NYDIS afterwards to distribute so that folks can explore those links if they're looking for testing in their area. And now I'm just going to pass this over to my colleague, Jenny, who is going to help us out with some framing around the reopening and the zones, which I know will be the main content for today's conversation, specifically tailored for this audience. So Jenny, thanks for joining today.
Yeah, thank you so much for having me. Hi, everybody. My name is Jenny Sutcliffe. I am a healthcare policy analyst at the Department of Health. And in these times, I've been working on our reopening guidance task force. So I'm excited to sort of chat with you all a little bit and share some of this updated information for you all to share with your faith-based communities. So let's move into our next slide here. Great. So as you all are probably aware, the governor has sort of issued what he is calling this cluster action initiative, which is trying to identify sort of hotspots across the city and the state, actually, that where we're seeing increased rates of transmission and increased percent positivity of COVID tests, and has indicated certain restrictions within those zones. And this is obviously an effort to try to slow transmission in these places so that other parts of the city, other parts of the state can kind of continue to remain open, if you will. So you can find the zones and kind of play around with the different maps on both our website and then also on the state website. And you can sort of see here the zones we have right now are sort of southern Brooklyn, central Queens, and then part of the far Rockaways. We can move on to the next slide. And there's 3 colors of the zones, although currently there's only 2. There's yellow zones. Oh, great. So you can see the yellow zones are precautionary. There have in the past been orange zones. Where the red zone is sort of the hotspot of the main cluster. And so there's different restrictions based on these different colors. You know, it sort of makes me laugh a little bit because when you go through, like airline security, and it's just always like a perpetual like orange, threat level orange, and like no one ever really says like what that means or like what the scale is. This is a little clearer, and there is the scale, and the scale goes yellow, orange, red. But in this particular case right now, the governor's just sort of delineated between a primary zone with the cluster and then sort of the yellow zone, which is a little bit more precautionary. Next slide. This is a map of kind of the Queens Far Rockaway cluster. You can see, next slide. And then this is sort of the other central Queens cluster. Kew Gardens, Forest Hills is kind of the area where this is focused. And again, on the state site, you can sort of zoom around and really see where the boundaries of these zones are. Next slide. Great. So what does this mean for you all, and how does this apply to you all in your questions? So for New York City houses of worship, there's a couple of different capacity issues, and that would be that For indoors, you're at 50% capacity, and outdoors, you can have any size with sort of physical distancing. Should I hand it back over to the, yeah, okay, great. I'm gonna hand it on over to Helena.
Perfect. Thank you so much, Jenny. We did actually have a question about the 90-day period for retesting for COVID-19, if one of you would be able to answer that.
Jenny, if you feel free to take that. Thanks for the great intro to the zones.
Yeah, no problem. Sorry, and I missed the question. It was, how often, can you repeat that?
Yeah, in the chat, someone asked, can you please clarify on the 90-day period of retesting for COVID-19?
Oh, sure.
Mm-hmm.
Yeah. So we're sort of recommending that if you have been tested for COVID and you had a confirmed COVID test, there's no need to be tested again 90 days after your symptoms began, or if you were somebody who was asymptomatic and had a positive test, there's still no need to be retested for an additional 90 days. And this is sort of due to some of the persistent positivity in testing that we found, and the fact that sometimes you can continue to test positive long after your symptoms resolve. So if you're looking for guidance though on when to kind of return to work in the community, you know, that's also found on our site, and we recommend that you can sort of return back to your more day-to-day activities 10 days after your symptoms resolve.
Great, thank you so much. All right, so now we'll dive into the portion for houses of worship. So we'll go through, sorry, we have to let this play for a moment. Here's an example of how to use the zone finder. I hope that by now each of you have clicked through to the link we sent with your registration to find out what zone you are in. And we want you all to keep in mind that these zones are shifting and changing based on what the virus is doing out in our communities. And so to stay updated and make sure you have the latest information on your zone, please do use this link to make sure that you're checking. So we have our 3 clusters currently in New York City. The rest of New York City that's not in a cluster zone, we are still in phase 4 of reopening. So if your house of worship is lucky enough to not be in one of the clusters right now with increased rates of COVID, you are in phase 4. Your restrictions right now are to have 50% capacity for indoor worship gatherings. And outdoor, you can have any size gathering as long as the 6 feet of physical distancing is maintained. Here, as I'm presenting on these restrictions and guidelines, NYDIS has put together all of this information in one document that's hyperlinked to all of these resources so that it's very easily accessible for your congregation. So I'll have my colleague Susan share those in the chat so that you're able to access them. So if you are in a cluster zone, what do each of these cluster zones mean for our congregations? If you're in a red zone, that means that your indoor or outdoor worship should be at 25% capacity of your space or 10 people, whichever number is fewer. If you're in an orange zone, your indoor capacity for worship is 33% of the space or 25 people, whichever is fewer. And if you're in one of the yellow zones, that's precautionary, you should be at 50% capacity for your indoor worship. Alana did mention that there are some executive orders now about wearing a mask in public, and you may be fined if you're not wearing a mask in public. As well, below we've listed that non-worship and worship gatherings that violate these restrictions in these zones may be subject to a fine of up to $15,000 a day. So making sure that we know what the executive orders state and what we are responsible for as congregations gathering. All right, so if you're utilizing your house of worship for a non-worship gathering, so we know that congregations can be community centers and provide other services to their neighborhoods besides worship. So if you're utilizing your house of worship for these non-worship gatherings, you must follow the restrictions for mass gatherings. So for mass gatherings currently, if you're in a non-cluster zone in phase 4, you're limited to no more than 50 people for your mass gatherings indoors. If you're in a red zone, non-essential gatherings of any size are currently prohibited. And this is due to the increased case numbers that we're seeing in red zones and wanting to make sure that non-essential gatherings where the virus might spread are not happening. In an orange zone, non-essential gatherings are limited to no more than 10 people. And in a yellow zone, non-essential gatherings are limited to no more than 25 people for indoor and outdoor settings. All right, so here are the guidelines and recommendations that are listed out by category now. We'll start with the mandatory physical distancing and personal protective equipment, or PPE. It is mandatory that you wear face coverings when you come within 6 feet of another household. And so houses of worship must also provide clean face coverings for congregants who attend a service and arrive without their own face coverings. It's also mandatory to maintain 6 feet of physical distancing between households. So we know that families might live split among multiple households, in which case that they would still be seated separately during your worship services, which is why we use the word household rather than family here. And if you are singing or preaching, projecting your voice in any way, you must maintain 12 feet of physical distancing. And then it is also mandatory to follow the occupancy guidelines for your area. So we reviewed exactly what that means for each of the zones. And so they're listed here below. All right. So some of the recommendations that NYDIS has put into our documents to help congregations abide by these restrictions is to try to seek alternatives for in-person gatherings. That way, if you have, I know many congregations have shifted to online gatherings, and they've transitioned actually a lot of their services to be available virtually. So make sure that we're maintaining those. I think especially as we've seen the resurgence of cases and these spikes in certain areas of New York City, we're recognizing that the virus is constantly shifting in its activity in our population. So if you do happen to be in one of the non-cluster zones and you've been in phase 4 for a while, I know that some congregations have looked into maybe stopping with their online or virtual services, but we encourage you to actually maintain those, especially throughout the winter, and knowing that flu season is upon us. So with all of those factors in mind, to please maintain those alternatives for in-person gatherings. If you do opt for an in-person gathering, try to meet outdoors. We understand that the weather is changing now, but wherever possible. We also recommend that you increase ventilation with outdoor air when you're indoors, so propping any windows or doors open safely. We recommend that you stagger schedules for your staff and members and volunteers. So if you have people who are working in your congregation offices, making sure that they're coming in on alternate days so that they're not in at the same time will help to reduce the spread. We also recommend that you place marking tape on the ground to assist people to navigate your space safely. So if you're inviting people into your space to utilize it, how are we making sure that we're helping them utilize it safely? So one of those is to place marking tape, post signs up. The other is to recommend the use of face coverings at all times, even if you can maintain those 6 feet of distancing indoors. All right. So facilities management and cleaning, these are some of the commonly asked questions that we get are in this category. So it is mandatory that you clean and disinfect according to the CDC and New York State Department of Health guidelines. So those are hyperlinked directly in the document that Susan sent out in the chat. So you can click on them directly and see what those requirements are and follow them. It's also required that you regularly clean and disinfect your facility with more frequent disinfection for high-risk areas. It's required that you have hand hygiene stations. So this is either a place for people to wash their hands with water and soap or hand sanitizer. It's required to frequently disinfect commonly shared ritual objects during your worship gatherings. And wherever possible, we recommend that you actually remove non-essential objects and reduce the amount of touching of commonly shared objects. It's required to place hand sanitizer near frequently touched objects. And so some strategies that I've seen are to place hand sanitizer before somebody would touch that ritual object and then immediately after. so people are sanitizing their hands immediately before and after touching that object. It's required to place waste bins around the sanctuary for people to dispose of their trash. And it's mandatory to determine your house of worship's capacity for in-person attendance. So one of the commonly asked questions we get asked, is this the capacity of your building or the capacity of the room you're using? And the answer is that it is the capacity of the room that you are using for how you would calculate what percentage of people and what number of people you would let into your space. It is also mandatory that you keep cleaning logs that document the date, time, and scope of cleaning. So this is also hyperlinked directly in the document to a cleaning log that the New York City Health Department has put out. And it's actually on the next slide for us to show you what that would look like. And you can place one of these in each of your rooms and make sure that you're documenting every time somebody either cleans or disinfects a space. I did go through the recommended actions to help support this as I presented it. So they're there for you to read. So this is the cleaning log template. And you could post one of these in each of your rooms and make sure that you train your staff and volunteers on how to appropriately fill these out. All right, so during your worship activities and services, there are a series of things that are mandatory according to the governor's guidelines. You want to follow the occupancy guidance. This is one that is repeated in many of the sections, so making sure that we know what our occupancy is and that we're following that. You want to ensure people maintain 6 feet of distance between households. So whether this means marking off pews between people if you utilize pews, or marking the ground to make sure that people understand where they should stand and what the space should be between them and the next person. You want to ensure a distance of 12 feet is maintained from any person singing or projecting their voice without a face covering. It's required to reduce the use of objects touched by many and to frequently disinfect those objects if you do keep them in the space. It's prohibited to share food or beverages within the house of worship, and we ask that you find alternatives for rituals that include consumption of offerings of food and drink. It is required to restrict ceremonial hand-holding, shaking hands, hugging, that physical contact. And for funeral-related services, there is a series of recommendations and guidelines to follow that are linked in the document, but this includes prohibiting touching, hugging, or kissing the body of a person who had confirmed or suspected COVID-19. So the recommendations that NYDIS has written out to support the completion of those requirements is to consult the CDC's considerations for gatherings. This is a document that's linked in our document, and it talks about what you should be thinking about before you invite people into a congregate space. We recommend that you hold services outdoors whenever possible, offering multiple service times to reduce the number of people gathering at the same time. This includes also cleaning and disinfecting the space between those gathering times, making sure that you have enough time between services to fully vacate the building so that people aren't crossing paths between services. We recommend that you create pre-registration for in-person gatherings, and that way people are able to reserve their seat or reserve their spot. You know how many people will show up, and this makes sure that you can maintain those capacity limits that you have, so that you don't have, I know one of the questions often on webinars is what if people show up, we feel bad to turn them away. So creating a well-known structure for people to RSVP for worship services. And we actually link to a draft or a template pre-registration form for you to look at and see if that would be something appropriate for your congregation. Adapt, adapt, adapt. I know many of us have been adapting now for months, but adapt your ritual worship activities to make sure that we're reducing the objects that might be touched by many, making sure that we're keeping an eye out for even things like door handles that people seem to be using. So really walking through your space and envisioning what it looks like for many people to utilize it. If you're considering reopening, making sure that we're looking at our space through the lens of somebody who's trying to make something as safe as possible for this virus. We recommend finding alternatives for group singing, such as instrumental or pre-recorded music if it's appropriate for your faith tradition. We recommend that you don't share microphones between multiple people. and that everyone has their own microphone for the duration of the service. Also utilizing those plastic microphone covers that can be disposed of between services. And we recommend emptying fonts and other water-related ceremonial spaces. All right, moving forward into communication and outreach. In the mandatory section, there are a few things listed here. You must affirm that you've reviewed and understand the state-issued guidelines, which are the ones that we're reviewing here today. That is linked in the document for you to access, and this should be a congregation decision maker needs to go to these guidelines and affirm and sign for your congregation and keep those on the premises. It's also mandatory to post CDC signage throughout your house of worship. So those are also linked in the document for you to see what the signage is and which ones you might be able to print out. And it's also required to clearly post your completed safety plans on site in a visible location. We go a step further and say, actually, as congregation leaders, we want you to communicate any changes you've made to your facilities to your congregants in advance of having them join the space. So any plans that you've made should be written, and then they should also be communicated with your congregants. So if you are reopening, we want your congregants to know exactly what to expect before entering the space. So what are some of the new ways you're utilizing your space, explaining to them the markings on the ground that you've placed, explaining the expectations when they arrive to the facilities. If you've implemented temperature checks at the door, letting them know that in advance. If you're requiring them to bring their own face covering, making sure that everyone is aware. If you have opened your restroom facilities for them to use, letting them know that they are open and available, and if not, letting them know that they're not available. These are all things that we want to communicate with our congregants before they join us in our space, so that they can also make an educated decision for themselves about whether they'd like to join that space. We want them to know what the risks are in advance. NYDIS recommends that congregations write and implement a crisis and emergency risk communications plan. We have linked in the document to a tip sheet for how to do that. And this is also a training that NYDIS offers periodically throughout the year to do a CIRC plan writing. We've adapted it to be online as a webinar now, much like this format. So it is recommended that you complete that. The concept of crisis and emergency risk communications is really that congregation leaders are essential communicators in their neighborhoods and in their communities, and recognizing that we want to make sure that there's a written plan for how they plan to communicate risk communication and communicate in an emergency. We recommend that you stay informed about local COVID-19 information and updates. We recommend that you maintain regular communication with congregants. So even about what rates are happening in your community and what zones you find yourself in, any information that the health department puts out, they're constantly releasing new information and tips and guidelines for communities. So making sure that you're sending those out periodically to your congregants so that they can maintain awareness about what's happening, especially with the holidays coming up. There are a lot of questions about gathering during the holidays, and I know that the CDC and the health department are putting together informational guides for community leaders. And so in that case, we would ask that you please distribute those to your congregants. All right. I've covered about staying in contact with your congregants and informing them of updates. Letting people know about the maximum capacity of in-person attendance in advance. And this is all for their safety. We also want you to maintain all of your online services. So another point here is that there are going to be congregants who are in higher risk categories who may not feel comfortable joining for in-person gatherings for quite some time, whether that be once the vaccine has been taken up by the majority of the population, or whatever the case might be for them personally with their health. And so in that case, we want to make sure that we're not excluding them from continuing to worship with us. And so making sure that we maintain those virtual access points for spiritual care, for emotional support, and for those worship services that you provide. All right, and then the other recommendation is that you provide additional emotional and spiritual support to your congregants and staff. Here in this room, we know as much as any other that COVID-19 has taken its emotional toll on the population. And we know that when people re-enter the space again, they're re-entering with some additional potentially trauma from COVID-19 and additional emotional impacts. And so when people arrive to our space, we want to make sure that we receive them well and that we receive them equipped to provide for what their needs are. So just reminding us that people will be arriving to our space differently than we have in the past. For regulation and screening of people who do arrive to worship in person, it's mandatory that congregations notify the health department if you have a positive COVID-19 test from one of your staff members or one of your volunteers who works in your facility. So if any of those people are volunteers who are providing services in your facilities, those are the people who you'd have to report a positive COVID-19 test. It is currently not mandatory to report a positive COVID-19 test if it's one of your attendees of an event. In case of one of your leaders testing positive, it's required that you cooperate with local or state contact tracing officials. The city has its own contact tracing program, and they're working hard to make contact with anybody who might have been exposed. It's also mandatory to implement those mandatory health screening assessments for any of your staff or volunteers who are reporting to your site to provide services. So your clergy, lay leaders, and volunteers must answer these mandatory health screening questions every time they arrive on site. And so those, of course, are linked in the document and are actually showed on a subsequent slide. NYDIS recommends that you encourage people with higher risk for severe illness to speak with their healthcare provider before resuming in-person activities. So making sure that people are aware of their risk in joining in-person activities. We also recommend that you include those screening questions in your pre-registration forms for your attendees, just as an additional way to make sure that we're staying safe. So that is also shown in the next slide. I'll switch over to that soon. We recommend that you implement temperature checks as a form of screening at the door. We know that just checking temperatures isn't the silver bullet. It doesn't mean automatically that everyone will be safe, because we know that asymptomatic spread of COVID-19 is a thing, but it is a form of screening. And so if you're able to implement that, to do so. And to make sure that you're not recording people's temperatures at the door with their name, because that is a HIPAA violation of their health privacy, but just implementing the temperature checks and admitting or not admitting people based on where they fall for that temperature. And for every in-person gathering, we recommend that you keep an attendance list. This will aid tremendously if contact tracers do need to be utilized. And it is responsible during a time of a pandemic to know who was in the space at what time. So this is an example of a pre-registration form that we have drafted, where people can list their names and how many members of their household will be accompanying them, and the names of those household members. So again, this would aid in contact tracing, an email and a phone number to contact them, and their primary language spoken. So that will also aid contact tracers to know which language they should be speaking when they contact them. Here, we know that congregations are not required to ask screening questions of the people who attend your events, but if you choose to do so, they are written out here. And you're not required to share the CDC guidelines before attending an in-person gathering, but we recommend that people do review this just to know what the latest information is about COVID-19 and what exposure might look like when they attend an in-person event. All right. And now we have made it through the requirements, and we're here to Q&A section. I see that we've got some in the chat that I'll get to in a moment. Some of the common questions here. Before you reopen, you must read the requirements sent out by the governor, and you must affirm them. and you must implement all of the requirements before reopening. The restrictions that apply for non-worship events hosted at a house of worship are those for mass gatherings. So that is the language that the city and the state use to describe those gatherings, and you should follow the requirements there. The current guidelines and recommendations for singing, the requirement is that people who are singing without a face mask indoors be at least 12 feet from any other household. But of course, NYDIS does recommend that if you are singing to be wearing a face mask indoors. If you're in a cluster zone, the regulations on occupancy, yes, they do affect outdoor worship. It is the same for indoor and outdoor worship. And to report a congregation that's not complying with regulations, if you're concerned for the safety of people who are gathering, you can call 311. The responders who would respond to that 311 call might be anybody from Department of Buildings, the health department. It depends on how that call is made and who's available. But people will respond to those. All right, so I see some questions in the chat that I will get to. Actually, Susan, do you mind reading them out so that I don't have to scroll through all the text?
Sure. So our first question is from Allison, and she asked to clarify, does the no food or drink guideline include rituals such as communion?
So the rituals such as communion counts as part of your worship, but we do recommend that you put into place any precautions that you can. So whether that means implementing single service cups so that it's not multiple people touching the same one, that people can pick up on their way into the worship service and hold with them, as well as the wafer as well. And we know that many alterations have been made according to religious traditions in response to COVID-19 to make sure that people are able to worship safely.
Great, thank you. We have another question from Reverend Franklin Williamson. What do we do when folks are traveling from red zones to your church?
This is a great question. And I wonder if someone from the health department would like to provide guidance for that.
You want me to chime in? You can jump in after. Yeah, that's a great question. I think that this question illustrates the reality that we are all New Yorkers, which means that we are a mobile people. And so I think that, you know, obviously people move through different zones. They might live in a zone, go to school in a different zone, work in a different zone. So I think that that's why it's really important to really implement all of the other steps that Helena mentioned earlier, so that when people are coming from red zones to your church or temple or space, that you know, you have all of those other things in place in practice to keep everybody as, you know, low risk as possible.
Thank you. Are there any other questions?
We just got a new question to further clarify the no food or drink policy. So the question is, are we able to implement a grab and go system where they are not sharing items, but they're individually wrapped?
So this depends. If you're using a grab and go situation for a ritual worship practice, so if it is something like communion, then yes. If you're doing something like a coffee hour where it's socializing after the worship service, or food that's not included in your worship tradition, then it would have to follow the guidelines for mass gatherings, in which case grab and go is the best system if you have something like a food pantry, and we know that that has been implemented across the board. There's a differentiation here made between worship and ritual food and drink that's being offered versus food and drink that's being offered separately, either as a social service or as a socializing or community buildings scenario. Are there any other questions?
There aren't any in the chat. If anyone has one, I'd encourage them to share one.
I have a question. Thank you for answering the one about the no food or drink, that last one. Basically, it's like a coffee hour that we have after service. And from my understanding, you said we just go back to the, what was it? The gathering?
Mass gatherings, yeah.
Mass gathering guidelines, yeah.
Mm-hmm.
And in reference to the mass gathering guidelines, actually, I have a member that just asked me if they can use our space to like host a birthday party or something. I think you kind of answered my question where I would go to the guidelines. We're not in the red zone, but however, we have to use the 50 individuals or less in the space, even though if we're not in the red zone, we can use 50% for worship gatherings. Mm-hmm. But because it's not a worship gathering, I have to tell her that it's 50 people or less, mm-hmm. as long as we're following the guidelines. Now, in reference to her party, would I have to also tell her that the food, if she's going to serve food, it has to be like a grab and go? I don't know.
Yeah, you also have to make sure that all the households stay at least 6 feet apart indoors. Uh-huh. And so by you offering your space, you have to make sure that people are following the rules within that space. Mm-hmm. So I know that might be difficult in a social gathering like a birthday, but setting those expectations up front, that if your space is to be utilized, it'll be with 6 feet distance between each household, mm-hmm. That people have to stay where they are seated and not be moving around, socializing. If there is food or drink, which requires the removing of masks, that means that they have to take it and go. Peter, would you like to add any additional onto this, as well as the health department? I'll open up the floor.
Okay, I think it's worth noting that eating indoors without a mask in an enclosed space is one of the most high-risk activities you can participate in. The only thing that would be more dangerous is singing in an enclosed space without a mask, because you're projecting everything that's coming out of your mouth and lungs across, that space. And we can only share what the recommendations are, but we have to name what's high risk, and eating indoors without a mask is high risk. The other behavior that seems to have sort of dissipated a little bit is recognizing that high-risk individuals are common participants in public worship. The elderly, people who are health compromised. And so this is really about protecting the most vulnerable people that attend worship and coffee hour. On the flip side of that, the social isolation for elderly people who live alone is crippling. And so to prevent people from feeling like the only place they're getting community is coming to worship or going to a worship-related reception, it's important for houses of worship to implement enrichment and caregiving activities that make sure that people who live alone feel like they're being reached out to by communities of faith and cared for and given an opportunity to interact. So we think that it's important to recommend that congregations do more to engage people who live at home in alternative ways, rather than the traditional things like coffee hour, which obviously I realize that coffee hour sounds trivial sometimes, but coffee hour is a place where some people, that's their one time a week to interact with their community of faith and get support and see their friends. And so it is important on a mental health level, but on a public health level, it's risky. So, I mean, that's just the kindest way I think I can put it. The other thing that we should talk about is like the use of church vans. That is perhaps one of the most dangerous ways also for high-risk individuals to be transported. Vans are even smaller than subway cars and buses. So church vans, I realize it's more common amongst churches than it is amongst other faith traditions, but church vans are high risk ways of transporting people in an enclosed space. As we go into the winter, you can't even leave the windows open anymore. When the windows could be open, it was less risky, but with the windows closed and heat on, those are also really dangerous places for folks to be transported, especially for long periods of time.
Speak quickly to the event question. I think that this is one of those kind of gray zones where it's absolutely your prerogative to let other people sort of use your space, provided they follow all of the guidelines, and you're aware with them on the procedures and what they need to do. But I also think, like if I take off my DHMH hat, I would probably, if I was a church, I think I would say, no, we're not really opening our space to things like that right now. Or we're interested in doing this outdoors, because Peter mentioned, especially eating indoors is a particularly high risk activity, and or just like really having a conversation with that person who's a part of your community and probably about like why that's risky, and see if there's alternative choices that they could kind of make.
So, I want to get to the question that Reverend Williamson asked about red zone travel. I'll tell you that in our office, we implemented work from home restrictions for people living in red zones. It's out of an abundance of caution. I realize banning people who live in red zones from participating in worship has different implications than employees who are more than capable of working remotely. I would simply say that if people who live in red zones are attending worship in your building, or essential gatherings like AA meetings and our, Al-Anon and things like that, they need to be extra cautious to be wearing a face mask, perhaps a face shield and things like that. Those are decisions. There's no recommendations here, right? People who live in red zones aren't banned from traveling or work or worship or those kinds of things. But I think out of an abundance of caution and out of consideration for other people, it's important to ask them to be extra careful if they're going to be participating in events. But I think banning people from worship is, that's very, very complicated.
Hey, Peter, may I say something?
Yes.
This is Pastor Franklin. Thank you all. It's awesome. I've been one of the evangelists for ensuring that we follow these 4 main protocols. I oversight quite a few churches, and when I look at the map, we have one in Far Rockaway. That's yellow zone, one in Brooklyn, red zone, and we do have interfaith services. So I'm having a call tomorrow evening to pretty much move that to virtual, because even though we have the map, the virus doesn't work within a zone, within a zip code. Right. So, and what I'm trying to do, because we've been open back up since July 26th, is to not lose the confidence and the faith for those who are coming in. So I rather err on the side of caution and be overly cautious. Like for instance, we have Stanley Steamer that comes in and do a full clean on top of the disinfecting that we're doing. So normally they'll come once a year. But now it's COVID. We bring them in, depending on the frequency in the sanctuary, 2 times already since we opened in July. So it's a comfort level. And let me be frank, you do have parishioners who are over 65 but are very healthy. And I can't tell them stay home. They do come. But they come because we are following the guidelines. We're asking those questions. We're wearing masks. We are sanitizing. We are sitting 6 feet apart. I mean, Eleanor came on and she spoke to the congregation. She saw the church has retrofit itself. So I'm advocating for pastors to really step up. I also have pastors who are saying it's some type of devil closing the church doors, and I rebuke such behavior. No. You just need one member to be contagious, and they blame the church. And thanks to God, we have not lost any. And it's about 120 members. And we've been good because we have been following your guidelines, Peter, and your organization, the governor and the mayor, to the letter. And I appreciate the work you guys are doing. Keep it up. And I know the government really can't dictate to the church, but I'm a pastor. I can. Yeah, I'm pastoring this work, and this is what we're going to do. And you guys said 65% alcohol content. I get the one that has 70. Hello, you know, I go the extra 5%. So, you know, that's, and you say 50%. My how we do, we have 45, and they got to book their ticket like getting on a plane, right? And once the church is full, you just go directly to Zoom. And if you don't show up, that's okay. You know, you may have someone walk in, there goes an extra seat for someone who walked in. So they got to book their ticket. There's no question about that. It's the new normal. We got to be firm. And as a result of that, we are actually operating at 45. You know, folks are coming, and they do a 2-week shift. If I came last week, let me wait until the last minute to book my seat so someone who didn't come the week before have a chance to get into the sanctuary. And it's working. If you get their testimonies, no one is having a problem. However, the big challenge for us though is singing with a mask. I must tell you, we sound terrible. We sound terrible. I mean, no one is raising their hand. No one is enjoying the choir. There's no more choirs, but we're trying our best to identify what mask allows the sound to come through. So if you guys find a mask that help us with the sound, we will buy them. But thank you guys. Thank you guys. Thank you guys. I appreciate you.
Thank you, Pastor Franklin. I was going to say, your church that I saw was the epitome of adapt, adapt, adapt. You've adapted your space. I saw how you were able, because you have the individual seats out, it looks like, it really does look like an airplane when you're booking a ticket to go fly. You have the seats selected, they're highlighted different colors, people select their seats. When people board or enter the sanctuary, you have them enter the sanctuary in order so that they're filing in order, people aren't crossing paths. That adaptation is what we need to see, and you've done an excellent job of doing it with joy as well. So thank you so much for being a leader in that. And that's what we hope to see faith communities stepping up in that way. All right, so we are at time, and I want to recognize and respect people's times. Thank you so much for joining us today. We hope that the Q&A was useful for you and that the information presented is able to be implemented. We have the links in the chats, but I will send a follow-up email with an evaluation. Please, if you fill out the evaluation, you get a link to the recording of this webinar that you can share. So please fill out that evaluation and let us know how we can improve these sessions as we plan to host many more throughout the fall. So thank you for joining us today. We hope you have a good rest of your day. Take care, everyone.
Thank you so much. Really appreciated being here.
Thank you very much.